what nurse practitioners do, depending on where you work. I have other nurse practitioner friends that actually do work in primary medicine that are on call, so you've got to be available. I see an average of 14 to 18 patients per day. Those range ages, yes, mainly pediatrics and women ages 18 to 65. I do see males, I do see elderly, but not the majority of the population. I don't do any prenatal or obstetrical care.
Those 14, 18, what's the average time that you're with them?
Yes, 15-minute or 30-minute blocks. So a 15-minute appointment would be like a medication check. If they're on a high blood pressure medication and they need to check up on that. If I started them on, maybe an antidepressant a month ago, I'll see them back. Any coughs, colds, sore throats, knee pain, back pain, anything acute, like that just kind of happened that they're being seen for a sick visit. Most of those are just 15 minutes. 30 minutes are limited to well-child exams, wellness exams, physical exams, whatever you want to call them, pre-op exams. So the anesthesiologists want people to be in tip-top shape before putting you to sleep for surgery. Make sure that all your complex medical conditions are optimized before we're giving you anesthesia to put you to sleep. So those exams are 30-minute appointments. Very, very in-depth appointments about family history, medications they're on that might interact with anesthesia, what medications are safe to take before surgery, what medications do they need to hold the morning of surgery. Those are very interesting exams, and get even more complex when the patient comes in and hasn't been seen for a long time and has a heart murmur. Well, if you've never been worked up for a heart murmur, you're not having surgery next week. And that is always interesting to tell somebody who's planning their vacation, time off work, work coverage. That happens quite often.
So that allows
But very
you,
important.
that time allows you, how much time can you do your papers, your charts?
0. So I work through my lunch hour. I usually start seeing patients at 8:45. Most of the people in our clinics see their first patient at 9. Some actually start a little bit earlier. The ones that see them at 9 also go to see their patients in the hospital in the morning, so they need a little bit extra time in the morning before they come to clinic. So that takes me till about, I do take a noon patient, because when I was starting my practice, I wanted to be able to get patients, just get them in. People like to swing in at their lunch hour. And then my last patient's usually about 4:30 or so. And I'm done right around 5 o'clock most days. But my charting is between patients. It's all electronic medical records, very little on paper anymore. But what people don't realize is it's not just patients and closing charts. You've got the insurance companies calling you. You're signing paperwork. You're signing school excuse letters. You're signing care plans for physical therapy, occupational therapy. Patients are calling with questions about their medicine, questions about an illness. So you're kind of trying to get all of those questions in between seeing your patients and getting all your charts in. The electronic medical record is fantastic. There's a lot of things that are pre-ordered in there, and it makes it really pretty quick. But it is a big, it takes a lot of time. Over the years, I've been doing less and less work at home because I've been able to really focus and tailor that in when I'm at work in the clinic. So. Work with NP students. So I think I'm on my 9th nurse practitioner student that just started with me. So they're in there. They're doing clinical rotations. They're seeing the patients with me, and I'm teaching them along the way and doing charts and seeing patients and answering questions. So it's really fun. Again, that's the teaching aspect that I love. To put the bad and pediatrics is much I love, making a difference. While there are times when you're really going to upset somebody and they're going to say that they don't like you and their other provider did things a different way and they're never coming to see you again, that happens very rarely. But when people give you a compliment, as with any job, it makes you feel good. Patient-family satisfaction. The hard part, discussing abnormal labs, imaging tests. So I've had probably about a handful of people that I've diagnosed with cancer. Some were expected, some were not. 3 of those people have passed. 1 had pancreatic cancer. 1, she was young, early 60s maybe. 1 with breast cancer, she was very, very young, late 30s. And another one with lung cancer. And actually I have her x-ray up here for you to see later, and she passed away last week. So usually those people, you are not relying on the nurses to relay that news. You are getting on the phone, you're calling them, and you're saying, I come in, bring a family member, we have stuff that we need to talk about, and you do the best you can. You answer their questions the best you can, you get them to the specialist, and they're not easy conversations to have. one of the biggest frustrating things I think with my job is just people that don't do what they ask you to, what you ask them to do. How many times do people come in with a sore leg or a sore knee or their back hurts or whatever it is, or their blood pressure's really high, like really high, and you put them on medication, they just don't take it, which is fine. But then you don't probably need to be coming back. Because what am I gonna tell you? I'm gonna tell you to be doing what I told you to do the first time around, right? Diabetics is one of the biggest complaints that I have with people, that they just don't care about their diabetes. They don't care if their kidneys fail, or they feel so well, they don't have symptoms of uncontrolled diabetes or uncontrolled high blood pressure until they do have symptoms, and then it's too late. It's very, very, very frustrating as a comparer. Charting, we talked about, doing less and less of that at home, which is really nice. And of course, death of patients. I have not had many, but even though we share clinics or patients at our clinic, so I see a lot of patients that are not mine per se, that are elderly and have passed away. And it's never a fun thing to deal with. So there's me. This is my friend's little guy. He's like 9 months old now. That was his pride. He's looking kind of orangey, so it's probably his 1 week well baby check. I know as another patient of mine. My medical assistants love to make our patients happy and write things and give them suckers and treats and all that sort of stuff. Perks, versatility. So if you are considering the medical field to any degree, but you don't like surgery, you don't like bones, you don't like blood, you can get through it. You can work in dermatology, cardiology, you can travel, you can work in a hospital, you can work in a clinic, you can really pick whatever area of specialty you'd like to go in. And if you pick something and you don't like it, pick something different. So don't let anything that might make you nervous or scare you about the medical field deter you from at least trying it. Again, opportunity to travel. In fact, I just saw a patient last week. She's single, not married, no kids. Just her and her dog, and she just gets about 8 or 12 week contracts, and she just travels. She'll go and work, and she's just in Pennsylvania, and she's going to go down to Texas, and then she'll come home for a couple weeks, and they make a lot of money. So if you're not tied down and you want to travel, it's a great opportunity. Collegiality within the healthcare team. In fact, 2 of the doctors that I work with now were residents when I was working in the hospital. So I know a lot of people within the healthcare organizations actually around town that I can collaborate with. I can get on the phone, call my friend Laura over at GI and say, hey, I got this patient, can we talk through it? Can we do a brief consult over the phone? Give me some tips, what can we do, which is, it's nice to know people. Educating the community, there we go. Preventive medicine, as we talked about, and advancing the profession of nursing. Okay, I apologize, you guys. Some of these are normal and some of these are not, but I will talk through these. This is the fun part that students always love. So I've got some x-rays for you guys to kind of look at. This is a guy's leg that is supposed to be this way, okay? So femur, foot's coming down here. So 23-year-old male, prior ankle surgery. He had hardware placement, as you can see. Anyone have hardware in them? Hardware? Looks cool on x-ray. Anyone have like you guys are kind of young, but anyone have their gallbladder out or anything like that? You can always see clips and stuff like that. When people have cardiac surgeries and they crack your sternum, open your sternum up, and then they wire it up, and that is what it looks like on an x-ray. You can see their sternum and wires all around it. It's pretty cool. Pacemakers you can see, defibrillators you can see on x-ray. So this guy had this surgery done, and ongoing left ankle pain and swelling, and he actually, it doesn't show up really well, but where you can see the arrow, the radiologist are like, hey guys, this is pretty obvious, but he actually broke the screw that was in his ankle. So he went on to have another surgery. I don't think it's often that you break hardware. In fact, a lot of hardware is removed. Finger surgeries, a lot too. Arm surgeries, hardware will be in for healing, and then they actually go back and do another surgery and take it out. This was a 9-year-old, pretty obvious. It's supposed to be this way. It's her right arm. She fell. She broke both her radius and her ulna. She had subsequent surgery. She actually had a lot of nerve damage from her initial surgery, a lot of numbness, tingling in her hand, and went back and had another nerve surgery, and she's been fantastic. So she just was doing a cartwheel and fell. Yes. So this was the patient I was talking about with the stage 4 lung cancer. So she came in with coughing, shortness of breath, did initial x-ray. The interesting thing about imaging tests is people often don't realize that a chest x-ray looks different than a CT scan, that looks different than an MRI. They look at their different way, and ultrasound. Ultrasound looks more at tissue. Chest x-rays are a pretty brief, generic sort of look at the chest or whatever you're looking at as far as an x-ray, but CTs look at things differently than MRIs look at things differently. So if you've ever hurt your knee, they did an x-ray and they're like, oh, your knee is fine, it's no big deal. It doesn't show tendons, it doesn't show ligaments, it doesn't show muscle. So if you're doing your anti-inflammatories and you're getting to physical therapy and you're like, this is not getting better, then they'll order the MRI and they'll say, oh, look, you tore your ACL. So this lady had a huge mass in her right upper lobe, I believe it is, yes, right upper lobe. Lots of nodules throughout her lungs, and those were all cancerous. So she went through treatment and she had a very, very rough treatment, and she ultimately passed. She was a smoker, by the way. This is my husband. Broke his finger. Well, I wouldn't actually say, I mean, he fractured this chip. There's the bone is supposed to be, oh, uh-oh. This bone chipped here so that the finger came off of the joint. And thought he'd have to have surgery and pin it, but they were able to just cast it and it stayed in place. And it's not the middle finger, it looks like the middle finger. 1 month
I had her
old.
husband as a student when I was at East.
Speaks to the oldies.
This was interesting. So this is probably very difficult for you guys to see, but I had a 1 month old. So 1 month old was seen in the hospital, probably day of birth, day 1, day 2, discharged home, saw me at 1 week probably, and then came in 1 month later and the mom's like, he's fussy, he's crying. She says, I see a lump by his collarbone. And sure enough, he had a broken clavicle, collarbone so when a baby's coming through the birth canal, something's gotta give, and it's usually the collarbone that breaks, yep.
What did your husband do that he separated his finger?
I think playing football or something.
Oh,
Doing some guy stuff. And it's not fractured again, or it's not, it stayed, so with that tiny little bone chip there. So yeah, when something heals, it forms what's called a callus. So let's say you stubbed your toe, and you're like, well, you can't do anything about a stubbed toe, I'm not gonna go in, and it's been 3-4 weeks, and you're like, my toe's really swollen, it still really hurts, and you go in, and they do an x-ray, they can see that there was a fracture there, and now it's healing, and they formed a callus there. And that baby's fine, we don't do anything, we don't give them pain medicines when they're 1 month old, we just kind of pinned his arm to his shirt, and it already showed a callus, so there was no follow-up x-ray. As long as he's clinically improving, there's no need for a follow-up x-ray, but oftentimes a follow-up x-ray is indicated for certain fractures. This one, abdominal pain constantly, kids are constantly constipated. So this is supposed to be this way, spine, ribs, pelvis, colon. So lots of those kiddo extras, so tummy aches, tummy aches, tummy aches. It's another one, interestingly, 21-year-old developmentally delayed female with persistent abdominal pain and distension. This girl's belly, you guys, was out to here all the time, so you can't tell me she wasn't in pain. Lots of air. So all this dark stuff, again, this x-ray is supposed to be like this. All this dark stuff is air in her colon. She had, I think she had Hirschsprung's. I forget what she had as far as she had a congenital GI issue, and she went in for a colostomy placement where they make an incision, they tie off the part of the intestine, and they make an incision through the abdomen, and then they have a colostomy bag there that collects stool. And she's like, her quality of life is fantastic. That was done at Freighter. So I just saw her mom. I haven't seen her for a while. I see her whole family, but her quality of life is significantly improved. 17-month-old female with fever, cough, and wheezing. X-ray showed right upper lobe pneumonia where the arrow is. There's just a density there that you can see the white. Sorry, that image. Sideways. And she did well with, of course, the antibiotics. 2.5-year-old female, fever and cough. Chest X-ray showed a right lower lobe pneumonia. Successfully treated with a course of oral antibiotics. The radiologists are so nice. Like I said, they put these X-rays here. They must think can't read X-rays. So you see this density down here in the right lower lobe, and then when you turn the image, you can see it again on the side view. 40-year-old female presented with right foot and fifth toe pain after stubbing her toe on a metal chair. That happens often. She had an oblique, minimally displaced fracture here. So a lot of times you can see what we're looking for on x-rays is we're looking for everything that's really clean. Things that don't look out of proportion of really where they're supposed to be. So if you can see this rough edge here, I don't know how well you guys can see that, but she definitely had a fracture there. It was pretty close to being all the way through. So I put her in a boot and sent her to podiatry, and it just healed on its own. They did the follow-up x-rays there. Yeah, isn't that nice? 3-year-old, pretty uncommon, you guys. She actually, this is a patient of mine, her mom works at the clinic. 3-year-old, fever, sore throat, swelling glands. Strep test was negative, and they said, I think you have strep, I think you have strep, even though your test was negative. And she had mono. So how many of you have had mono? Probably a good number. Probably a good number of you have had mono and never realized it. She actually had a tonsillectomy. When she had chronically enlarged tonsils, snoring, tired all the time because she had restless sleep and was snoring, and they took her tonsils out. Not super common in a 3-year-old, so could have been missed. Not life-threatening if it was missed, but she was pretty miserable for a while. 2.5-year-old female who swallowed a charm. Her friend gave her a charm, so she swallowed it. So those things, depends on what it is. If it's sharp into your esophagus, medical emergency. If it's a marble, a penny, a coin, those usually pass through, but we follow those to make sure all of a sudden it's not getting lodged. We had a boy that swallowed a BB that was made of lead, and it was tiny, but he wasn't passing it in his stool, right? He wasn't passing it. Parents are watching. Wasn't passing it, and we had to decide, are we going to take it out, or are we just going to continue to watch it? Is it going to get embedded in the colon? And we actually ended up checking his lead levels with the blood to make sure that his lead level didn't go up because he had a BB in his intestine. So this girl had to actually go in under anesthesia and have them remove that by an endoscopy. That's my family. So, questions? We have some time. Go ahead.
Do you diagnose a lot of patients with diabetes?
I think a lot, isn't it? No, not a lot. I have patients that have diabetes. There are 2 different types of diabetes. Type 1 diabetes is diagnosed younger. That's lifelong insulin. Their pancreas doesn't have the ability to secrete insulin to bring down their blood sugars. Type 2 diabetics are usually older age and usually are poor dieting or overweight. Diabetes is a hard one. It goes back to that non-compliance. If you're fine, why should I take your medicine? If you're fine, so you don't. So your kidneys are bad and you're on dialysis, or you have poor circulation and then you have your leg cut off because there's no circulation in your kidneys. So I wouldn't say a lot, but we definitely see a lot of it in pregnant care. Other questions? Yes.
So you're like working down at the clinic at Conewater. You mentioned you don't really make hospital visits, but do you ever like come to the main Aspirus hospital that's here?
I just come to see, if my patients are hospitalized for some illness, I will just come see them to
Say hi.
say hi, see how they're doing, and that's about it. Some nurse practitioners actually work as hospitalists, so a hospitalist is somebody that just works in the hospital. They don't have a group of patients that they see on their own. They just see those patients that come in and out of the hospital. Pretty impressive with those nurse practitioners. They do a lot. They're seeing the patients, they're writing orders, they're going to all units of the hospital. I had a friend that was a hospitalist, and she had a lot of ICU experience, so it suited her well. What else? Yes.
How many patients do you have?
I just looked at my panel, and I think it was like 2,100. So,
And all their names.
if I know your name, it's either a good thing or it's a bad thing. It's really fun to work in primary medicine.
Well, hold on, don't put away yet, we have time.
Because you really get to know the patient. If the patient has diabetes and has high blood pressure and they've had multiple psychiatric issues and things like that, when they don't feel well, they just wanna see you. They don't wanna have to go to the walk-in and tell their whole story of their asthma, and how many times they've been in the hospital, and on and on and on. It's really nice to have that continuity with those people. It makes it fun. Talk about, we have extra time in a clinic and they're healthy and they're feeling good, we're like, what have you been up to, and just chit-chatting and just really developing that relationship so they're comfortable to see you and talk about things. Sometimes it takes people a while. I've seen patients sometimes for years before they're comfortable telling me things that have happened in their life, so it's nice to see those people over and over.
So what's your oldest patient?
Mine, I don't know. I have maybe a few that are early 80s. Few. I have none in the nursing home. I don't work in a nursing home. A few in assisted living, and I saw one the other day. Well, she's just yesterday. 88 years old, very spry, comes in, drives herself in, coughing, sick. Treated her, and I'm going to see her on Thursday for follow-up. So,
Can I ask what your address is?
like my
Like your mailing address?
There we
at the
go.
clinic. There you go. Sorry.
Thank you.
If anybody wants to shadow, it can be 2 hours, it can be 4 hours, it can be 8 hours, like a clinic day. It just needs to go through the Human Resources Department and Aspirus. So if you have questions, let your teachers know if that's something you're interested in, just to shadow, even for a day in the clinic. Like I said, I do have a student with me right now 2 days a week, so we'd have to work around that. But other than that, it would be nice if you wanted to come in and just see what things are all about. It just, you have to sign some HIPAA stuff. And it has to go through that.
So this is the clinic right by
Dan Mountain, Harley down there, yep. We have 3 nurse practitioners now, including myself. We have 6 doctors, I think, and 2 are retiring. So our next year or 2 could be a little crazy if we can't recruit.
No. I had to pull up my pants.
Oh, the one in prison?
My God.
Any other questions? All right, let's thank Rebecca for coming in.